Role of kidney in blood glucose regulation. How kidney functions in regulating blood glucose level. Kidney is involved in three mechanisms. Three mechanisms takes place in kidney by kidney to regulate the blood glucose concentration. Number one is it utilizes glucose following meal. It utilizes glucose for its energy requirement. That is, it takes up glucose from blood circulation to satisfy its energy needs, number one. Number two, it reabsorbs glucose, which is secreted in the glomerular filtrate. And number three is gluconeogenesis. So by these three mechanisms, kidney regulate the blood glucose concentration. Number one, taking up glucose from the circulation to satisfy the needs. Number two, reabsorbing glucose from the glomerular filtrate. And number three is gluconeogenesis. We'll address them one by one. Number one is taking up glucose from the circulation to satisfy its need. See, following meal, the utilization of glucose by kidney increases. But after an overnight fast, this utilization decreases to approximately only 10% of total body's glucose. I'm repeating, following meal, the kidney utilizes glucose. The utilization of glucose by kidney increases, but after an overnight fast, only 10% of the glucose is utilized by kidney. Second comes glucose reabsorption. See, in one day, approximately 180 gram of glucose is secreted and reabsorbed by the kidney from the glomerular filtrate at the proximal tubule level. The reabsorption is possible with the help of transporters. Active transport with the help of sodium coupled glucose transporter and passive transport with the help of glucose transporter. Normally, approximately 180 gram of glucose per day is filtered and reabsorbed at the level of proximal tubule. The process of renal glucose reabsorption is mediated by two types of transporters. Number one is sodium coupled glucose co-transporter, that is active transport, and number two is glucose transporter, that is passive transport. So these were the first two mechanisms, glucose utilization and glucose reabsorption. Third comes gluconeogenesis. As we know, kidney consists of three regions: renal medulla, renal cortex, and renal pelvis. So this renal medulla, it consists of enzymes only for glucose utilization like brain. It consists of enzymes for glucose phosphorylation as well as for glycolysis. But it does not consist of enzymes for gluconeogenesis. It lacks enzyme glucose 6-phosphatase as well as other gluconeogenic enzymes. Hence, the portion of kidney medulla is unable to synthesize glucose and thus contribute in blood glucose maintenance. Kidney consists of renal medulla, characterized mainly by glucose utilization. Cell can only use glucose for their needs like brain, have enzymes capable of glucose phosphorylation and glycolysis. Cells do not have glucose 6-phosphatase and other gluconeogenic enzymes, therefore unable to release glucose into the bloodstream. The other part, that is renal cortex, it consists of gluconeogenic enzymes, hence capable of producing and releasing glucose into the bloodstream. So this is how kidney is involved in mechanism of gluconeogenesis. So these were the three mechanisms by which kidney is regulating blood glucose level. Number one is utilization or taking up of glucose from the circulation. Number two is reabsorption, and number three is gluconeogenesis. Now, gluconeogenesis, as we know, it takes place in two organs, that is liver and kidney. See, most of the gluconeogenesis takes place in liver. Liver accounts for 60 to 90% of gluconeogenesis, while kidney accounts for 10 to 40% of gluconeogenesis. So as we can see, most of the gluconeogenesis takes place in liver. However, in diabetes and prolonged fasting, the relative contribution by kidney is increased. Most gluconeogenesis occurs in liver, but the relative contribution of kidney is increased in diabetes and prolonged fasting. There are 4 precursors for glucose. Number 1, amino acid, lactate, glycerol, and propionate. Among these 4 precursors, propionate is the minor precursor in non-ruminants, while it is the major precursor in ruminants. So the major precursor in non-ruminants are lactate, glycerol, and amino acid. Lactate, glycerol, and amino acids. Now, regarding lactate, it is a predominant source in liver as well as kidney for gluconeogenesis. But regarding amino acids, as we know, liver mainly utilizes alanine to synthesize glucose, but kidney mainly preferentially uses glutamine for synthesis of glucose. So there is a difference in this, that is amino acid in liver mainly utilizes alanine and kidney mainly utilizes glutamine for glucose synthesis. Now, what mechanisms are involved in regulating gluconeogenesis in liver and kidney? We know that there are three hormones, mainly three hormones which regulate gluconeogenesis: insulin, glucagon, and epinephrine. What is the role of these? Insulin, it decreases gluconeogenesis in liver as well as kidney. Glucagon stimulates gluconeogenesis only in liver. And epinephrine, it stimulates gluconeogenesis both in liver as well as kidney. Insulin inhibits glucose release from both the organs. Glucagon stimulates glucose release from liver. And epinephrine stimulates glucose release both from liver as well as kidney. This finishes role of kidney in regulating blood glucose level.